Dr. Mike, an actively practicing doctor with over 25 million followers, has created one of the largest health education platforms in the world. His mission is to combat misinformation in healthcare and provide his viewers with honest, transparent, and engaging information to help them make informed decisions for themselves and their families. Dr. Mike's journey began as a medical student where he observed the lack of effective communication between doctors and patients. He realized the importance of being a good communicator in the healthcare space and saw the rise of misinformation in the media, particularly on social media platforms. This led him to start his own platform to provide accurate and evidence-based information to counter the spread of misinformation. With 12 million subscribers on YouTube and a significant following across other platforms, Dr. Mike has leveraged social media to reach a wide audience. He gained popularity by sharing his medical journey on Instagram and later transitioned to creating engaging content on various health topics. By combining humor, education, and entertainment, he has been able to capture the attention of millions of viewers. Dr. Mike emphasizes the importance of critically evaluating research and not jumping to conclusions based on sensationalized headlines. He approaches new studies by integrating them with existing knowledge and medical training to provide a balanced perspective. He acknowledges the limitations of scientific research and advocates for transparency and nuance in healthcare discussions. When it comes to weight loss, Dr. Mike stresses the significance of balancing caloric intake and nutritional value in a diet. He highlights the need to consider individual factors such as pre-existing conditions, lifestyle, and budget when recommending dietary changes. He cautions against extreme diets or relying solely on exercise for weight loss, emphasizing the importance of sustainable and balanced approaches. Contrary to popular belief, Dr. Mike challenges the notion that exercise is the primary method for weight loss. While exercise has numerous health benefits, he explains that it is challenging to burn off excess calories through physical activity alone. He cautions against equating physical appearance with health and emphasizes the importance of a holistic approach to wellness that includes both diet and exercise. Dr. Mike warns against seeking shortcuts or quick fixes in healthcare, as they often lead to negative consequences. He highlights the need for individualized and evidence-based approaches to health and wellness, rather than relying on fad diets or supplements. He encourages patients to be open about their previous experiences with dieting and to work with healthcare professionals to develop sustainable and effective strategies. Dr. Mike highlights the common dialectics in healthcare, where two opposing ideas can both hold truth. While the science behind calories in, calories out is well established, the application of this concept can vary based on individual factors such as pre-existing conditions. He emphasizes the importance of considering individual differences and the need for a personalized approach to healthcare. The discussion also touches upon the benefits of exercise beyond weight loss. Dr. Mike emphasizes that exercise offers a wide range of physiological advantages, including improved mood, social connections, strength, and longevity. He highlights the importance of regular physical activity for overall well-being and emphasized that exercise should be viewed as a holistic health practice rather than just a means for weight management. Dr. Mike expresses concerns about the current state of healthcare, citing a loss of trust in healthcare advice and agencies. He also raises questions about the societal trends towards processed foods, unhealthy lifestyles, and overmedication. He ponders the potential consequences of these trends on public health and emphasized the need for a collaborative approach in addressing healthcare challenges. The conversation shifts towards the increasing awareness of ADHD and neurodiversity in society. Dr. Mike acknowledges the importance of recognizing neurodivergence and respecting individual differences in healthcare. He highlights the need for open discussions about mental health conditions like ADHD and autism spectrum disorder, emphasizing the importance of autonomy and personalized treatment approaches. Dr. Mike shares a personal story about coping with grief and mental health challenges following the loss of his mother to cancer. He emphasizes the importance of seeking help from medical professionals and addressing mental health issues openly. The conversation also delves into the impact of social media on mental health, with Dr. Mike sharing his struggles with anxiety and addiction to checking social media. He highlights the importance of setting boundaries and taking breaks from social media to prioritize mental well-being. He emphasizes the need to balance online engagement with self-care practices and seeking professional help when needed. Dr. Mike stresses the importance of using social media with intention and purpose, rather than passively consuming content. He highlights the potential negative impact of social media on mental health, especially during moments of despair. He also mentions the research conducted by Dr. Robert Waldinger on happiness and the different ways social media can be used to either enhance or detract from well-being. When discussing supplements and vitamins, Dr. Mike highlights the lack of necessity for most supplemental vitamins, as the majority of essential nutrients can be obtained from a balanced diet. He cautions against the marketing tactics used by some supplement companies to promote their products, often making unfounded promises and selling products without sufficient evidence of their efficacy. He emphasizes the potential harm of supplements, including interactions with medications, side effects, and misleading labeling practices. Dr. Mike addresses the topic of the gut microbiome and the role of prebiotics and probiotics in promoting gut health. He emphasizes the importance of consuming foods that are beneficial for the microbiome, such as fiber-rich plants, and avoiding unhealthy habits that can disrupt gut flora. He discusses the limitations of current research on probiotics and highlights the need for more evidence-based recommendations when addressing gut-related issues. The conversation shifts to the issue of trust in medical advice, particularly in light of past mistakes and changing recommendations within the healthcare industry. Dr. Mike acknowledges that doctors and researchers are not infallible and that new information can lead to shifts in medical understanding. He emphasizes the importance of transparency, accountability, and ongoing learning within the medical community to maintain trust and credibility. Dr. Mike addresses the challenges and complexities of healthcare, including the influence of pharmaceutical companies, the limitations of animal studies, and the evolving nature of scientific research. He highlights the need for critical thinking, skepticism, and a nuanced approach when evaluating health information and recommendations. He emphasizes the importance of understanding the context and evidence behind medical claims, rather than relying on simplistic or sensationalized narratives. In a hypothetical scenario where he could redesign society for better health outcomes, Dr. Mike suggests removing phones from schools to mitigate the negative impact of social media on young individuals. He emphasizes the need for regulations and interventions to address addictive behaviors related to technology and social media. His proposed changes aim to promote healthier habits and environments that prioritize mental well-being and overall health. Dr. Mike reflects on his relationship status and the challenges of maintaining personal relationships while juggling a busy schedule as a medical provider and content creator. He discusses the impact of sharing personal information on social media and the need to be cautious about how much he reveals to protect his clinical interactions and online presence. Dr. Mike delves into his introspective nature, highlighting how he constantly evaluates his actions and seeks ways to improve. He shares his habit of reflecting on past interactions with patients, podcast interviews, and personal decisions to identify areas for growth. He discusses how this introspection can sometimes lead to anxiety, but also serves as a tool for self-improvement. The conversation shifts to the emotional toll of working in healthcare, particularly when faced with difficult decisions and patient outcomes. Dr. Mike shares the challenges of navigating end-of-life discussions, making tough calls in emergency situations, and coping with feelings of helplessness when patients choose paths that may not be in their best interest. The podcast takes a practical turn as Dr. Mike demonstrates the basics of CPR and educates the host on the correct techniques. He emphasizes the importance of calling for help first, performing chest compressions effectively, and dispelling common misconceptions about CPR. He shares insights on the purpose of CPR and the critical role it plays in buying time for professional medical intervention. Dr. Mike opens up about the emotional challenges he faces in healthcare, including moments of loneliness, grief, and burnout. He reflects on the isolation he felt after losing his mother and the impact it had on his social connections. He shares a story about the importance of reaching out for support and fostering relationships to prevent feelings of loneliness.